When friends and loved ones forsake you, all you got to do is to be bold. I knew it years ago that those who undermined me had their minds undermined, but I never mind. They should keep on undermining because I'm a real good. I must undergo mining. Talking of mining, it leads to discovery. We mine to discover, we learn to discover, we observe to discover. Friends can uncover you at the same time discover you. But I don't want to discover you, I would rather discover more, so I go on the internet and I listen to words of wisdom and intellect. Availability of information, interviews of great men and women all over the diaspora and all nations. Creativity at its best, dexterity of research, no need to go through any formal education. I introduce you to the Discovery Show. Let your friends and your family know the struggles before they blow, their highs and their lows. Pay attention to this show, it will make you feel at ease. The Discovery Show on YouTube got the steez. Now Perry, the presenter, please pose for the camera. I want to hear you say cheese. We are airborne like a flu. I want to hear you sneeze. True. The Discovery Show is live on air, Instagram, Facebook, YouTube. See ya. TDS TV, Yearn to Learn. Host, Perry Precious. Executive Producer, James.
Hi, good morning, good afternoon, good evening. You are welcome to the Discovery Show TDS TV here on Facebook, YouTube, Instagram, and Twitter. This is a show that seeks to interview professionals in the diaspora and beyond who are making significant impact in the area of healthcare, politics, nursing, religion, academia, and what have you. And basically, we seek to explore their lives. We want to know their journey so far so that together we can rise. Here on the Discovery Show, we say yearn to learn. So today is another time. I'm very privileged to be interviewing another gentleman who is making a significant stride in his own area. He is actually a registered nurse both in Ghana and also in Canada. And currently, he's a PhD student in the Faculty of Nursing at the University of Alberta in Canada. I'm privileged to be joined by Mr. Emmanuel Marfo.
Hello,
You're
Precious.
welcome, Emmanuel.
Thank you, Precious, and hi to all your wonderful audiences.
Brilliant. Thank you very much. So please briefly introduce yourselves to us.
Okay.
A bit more beyond what I've said, yeah.
All right. So to start with, I would like to acknowledge that I'm currently located on Treaty 6 and Métis Region 4 of the Turtle Island, what is currently known as Canada. And I'm consciously reminded that I'm a stranger and a visitor to this land. And I acknowledge the support of all the indigenous peoples who have occupied here and continuously live here to support us. So as mentioned earlier, I'm Emmanuel Marfo. I'm a licensed practical nurse, a registered nurse here in Canada and then in Ghana. And I'm a full-time doctoral student at the Faculty of Nursing, working with the Applied Immunization Research Team.
Brilliant. Thank you very much. Do you want to perhaps tell us a little bit about, prior to your PhD, what were you involved in back in Ghana, even before your master's as well, if you did?
Wow. Okay, so I completed my Bachelor of Science degree in nursing with a pediatric major from the University of Ghana in 2016. Right after that, I got the opportunity to serve as a teaching assistant at the School of Nursing, specifically Department of Research, Education and Administration. Whilst in that position, I also, during that political contest, we were not sure whether we were going to be posted after our clinical rotations or whatever it is. So I was also exploring other areas of employment because I wasn't ready for that unemployment story. So whilst doing my TA-ship with the School of Nursing, I was sending applications out to secondary schools, junior high schools as a backup so that after my TA, if I don't get posted, I can still be doing something and earning something. So I also worked as a teacher at Anson Senior High School in Wejabawe, a suburb in Accra, and I was teaching biology, physics, and integrated science there from 2016 to 2017. After that, I did my rotation at West Municipal Hospital for 1 year. And after that, I also got the opportunity to teach pediatric nursing and community nursing at Nightingale School of Nursing in Adenta. After a year, I got the opportunity to work at Nestle Ghana Limited as a factory nurse. And
Wow.
5 months later, I migrated to Canada to pursue higher learning. So,
Very interesting. Very interesting. And I think I'm particularly interested about the fact that you've worked at different time points and different places. Tutor in secondary school, factory nurse, and all that. In the face of unemployment, including nurses, I mean, graduate nurses and all that, what would be your recommendations? What will you tell them to consider? I mean, in the face of unemployment, to be able to stay perhaps employed or relevant in the system other than just being home or being maybe misused by especially private facilities without any um, good salaries and all that, because you decided to take other opportunities like secondary school, factory nurses. What would be your recommendations and your tips for such people?
um, Precious, to address this question, we would I would like us not to emphasize much on the salary, but rather the intent to do something whilst waiting for the appropriate opportunity. So whilst I was teaching in the secondary school, I wasn't kind of making too much money, but the motivation was that I wasn't staying home for my family to tell me that um, you, after school, after all these investments, you are still at home and we are feeding you. We know the political context. We are not kind of lucky to decide when we should work. All these things are decided by the politicians, and so we have to be creative in exploring other opportunities. And I think as a degree preparedness, you have the potential to operate in so many areas, including, besides teaching, you could engage in entrepreneurship. You could start your own business. You may not have the capital, but with collaboration or even meeting people in position, you can start something on your own. And as you wait, like, our mentality has always been has always been like depending on the government and other stakeholders to provide us with job. But what I'm thinking is, what are the gaps? What are the areas that can you move forward as you are waiting for those opportunities to, serve? And that is something that I did. I wasn't earning that much, but so long as I was getting busy and still building my CV for the appropriate opportunity, I thought it was the best decision.
And that is particularly a very important point to make, to leverage on every opportunity that comes away, because of course, I'm sure that's actually transferred onto your master's application and processes.
Of
That could
course.
have definitely strengthened your application. So
And
tell us a
even
bit
now,
about anything now.
yeah, and
I
even now,
like
because
that.
I have been considering some um, positions in terms of teaching and those stuff, because my masters, I focused on teaching and learning. And of course, they will ask you, what is your teaching experience? And when you look at my CV, you will see that I taught in the secondary school for 1 year. I was a teaching assistant. By then, national service was paying like 350 cities by then, but I was still doing that, right? So, not for the immediate benefit, but using that opportunity to, in the interim, as you prepare for the greater heights. Yeah.
Brilliant. Thank you very much. Viewers, please feel free to drop your comment, like our page, subscribe to our page, share for other people to also hear Emmanuel's story and be encouraged. And of course, if you have any questions for Emmanuel, please drop it here. Definitely we'll ask him if necessary. My name is Precious Adadidiodu, ably produced by James Kobna Opo, and I'm speaking to Mr. Emmanuel A. Marfo, who is a PhD student at the University of Alberta in Canada. He's also a registered nurse from Ghana and at the same time a registered nurse in Canada. So he's a big man. He's a big man. So, Emmanuel, please tell us a bit about your master's application. Of course, you've just given us a tip of the iceberg, but what was the process for the applications? Take some time to take us through the master's application. Afterwards, we transfer onto the PhD application. If there's someone interested in coming to Canada to study for a master's, what is the process like? What are the successful tips for you so that they will be able to put in a strong application?
Okay. So I will still remind ourselves of the political context and how that is bound to our employment in Ghana. I knew that things were not going to be straightforward because as of the time that we were completing school, we were still on that IMF, whatever it is. And I was talking to some of my colleagues about exploring opportunities to go out and perhaps develop myself there. So I applied to a school in Austria out of frustration, and I got a program in psychology. And when I got that program, my supervisor by then in Ghana, Dr. Ajukwashi, was like, Emmanuel, what do you want to do with this psychology? A nurse going to read masters in psychology. And I was blocked. I couldn't, it was just like people are traveling, so I also want to travel. And my supervisor took the time to explain to me the impact of embarking on such journeys. If you are actually not passionate about it, how graduate school is like, and how that can shape your future. So I had seen some lecturers around who have come to Canada School of Nursing, Faculty of Nursing here, and done exchange programs, and I was motivated by them.
Okay.
But then I didn't know where to go, which website to go, how to apply, which card to even use to pay for the money. And there was this level 400 student in a different faculty who always promises me to help me apply. So I will walk all the way. I wouldn't walk. I will move all the way from Ofankor barrier in Accra to Legon campus. And then when I get there, I call this guy. He will tell me, "Oh, I'm not there. Let's make it this week. Let's make it this day." We did that to and for some months. And one day, I just told myself, I said I have completed University of Ghana as a degree nurse who can read and write. Why don't I visit the website and explore the kind of information that they need there? So that was the beginning. So I went to an internet cafe. I didn't have internet access at home. Of course, I had a laptop, but then I went to the cafe and then I went to their program page, programs website, University of Alberta, and I read a lot about that. Then one thing I did was I wanted to do something on curriculum development, which was motivated from my experience as a tutor at Nightingale School of Nursing. I'll talk about that later.
Okay.
So I looked at the faculty list and found a faculty member or professor whose recent work was on curriculum development or nursing education. And I sent them an email telling them my interest, gave my transcripts and my CV, and requested whether she could offer to be a supervisor for me. And she was like, "Oh, I'm glad to see this, that. You do not need a supervisor now to get into our master's program. Go ahead and apply and just make me a potential advisor."
Wow.
And I applied, I made the money, I made a payment, I was engaging with her from time to time, and eventually I got admitted.
Okay.
And that is one of the strategies that people don't know. Always reaching out to a potential supervisor gives
Okay.
you that chance of being selected, because one thing I've observed is that in grad school, admissions decision is normally influenced by the supervisor's availability and commitment to supervise you. So
That's
that
right.
was what helped me to get admission into the program. I got into the program without a scholarship.
Hmm. Wow.
So yeah, I got into the program without a scholarship. I must say that. And so going forward was the collective support of my family and friends. But then as I integrated into the program and I did well academically, there was some opportunities for me to get some grants and
Okay.
awards. And past after the first year of my master's program, some professors started approaching me and advised that I get into the PhD program. But then, being an international student, you are kind of thinking about your immigration status. You
That's
want
right.
to complete school and get a post graduation work permit and then get some Canadian experience so that you can apply for the permanent residence.
Yeah.
And so even though I could have transitioned from the master's directly into the PhD after the first year, upon consultation with some senior colleagues, I came to decide that it wasn't the right idea. Let me finish the master's and get the Canadian credential that can also help me search for jobs whilst in my PhD
Yeah.
program. And so after um, the first year, what we did was to just give up with the thesis master's program and switch into the capstone so that I can complete the program early. So the capstone is something like a secondary analysis literature review that
Okay.
helps you do more courses and then you do that and then you meet the requirement for the master's credential. So I did that, and by 31st August 2020, I was done with my master's, and 1st September, I started my PhD.
Wow. Very interesting. You
Yeah,
did mention there was no funding for your masters, isn't it? But of
yeah.
course, as you moved on, you were able to access some grant opportunities.
And
Is
currently,
it
I don't
that
have any funding. I
for
don't
the
have any
PhD as
funding.
well?
Yeah, yeah.
Wow. Is it that because I can see there's a comment right from Mensa Bernard. He says, "Hi Emmanuel, are there any scholarship opportunities for those who can't afford a tuition?" So that ties in with the question I was going to ask. That is it that there were tuition free opportunities or there were scholarships, but you couldn't get that per your application, or there were nothing like that in your school?
So, higher education in Canada is quite different from that of the UK and the US. In that, in Canada, most of the public universities are provincially funded. And
Mm.
so although there might be scholarship opportunities existing, you will have to prove your academic work in order to assess them. You or unless there is a scholarship for designated for a particular country or a particular program, most nursing students I have seen in the faculty of nursing here, per my knowledge, come in by self-funding, how do we call it, self-funding themselves. But
Okay.
what exists here is that there are lots of grants, lots of scholarships, of
Okay.
you just have to work hard, study hard, and then prove to them that if I get this award, I can make this impact, and it's equitably accessible. Once you are able to show that, I mean, there are lots of awards. Like as I showed my CV to you,
Yeah,
I think you could see, you saw some of them
that's right.
on it. Yeah.
That's right. So is it that perhaps maybe right after the first semester, if the school assesses your performance and they realize you are good, then of course they could consider you for that application, that grant, or how is that? At what point in your 1 year masters or 2 year masters, depending on the school, are you able to access the grant?
Yeah. So, Precious, again, I also want to be mindful not to mislead your audiences.
That's right.
These scholarships vary from institution to institution. So I had colleagues in Eastern Canada, that is Ontario, Toronto area, who are doing their PhDs free
Okay.
without any tuition.
Okay.
Yeah, this is the faculty, this is the tradition that I have observed here. We do not admit students based on with scholarships unless you are bringing that from your country. But then we have series of scholarships during spring. That is between April and June. That is open for competition. Scholarships are earned on merit, and some of them too. You just have to go and compete. And at the university level, you may be nominated. And when you are nominated and you win at the university level, it's awarded, right?
Okay.
So I just want to be conscious about that. This varies from contest to contest. It may happen that within University of Alberta, there might be some disciplines where scholarships are given upon admission. But per my knowledge with the Faculty of Nursing, you come in and if you're able to prove what they are wanting, then you win those awards. And they are competitive. Let me put it straight for.
Brilliant. Thank you very much, Emmanuel. So, just to find, of course, you've been able to tell us how the journey has been moving from master's to PhD. Can you expand that a little bit? I mean, with the process itself. Of course, like you said, you did contact someone as a potential supervisor who had advised you accordingly to put in your application for master's and all that. In Canada, do you need to do anything like assess your certificate to see whether they are of standard compared to I mean, just like the US does in most cases? What is the process like really? Are there any costs for the application in your situation? Can you take us through the step-by-step process as you went through
Yeah,
for
I
both
like that.
masters and PhD? Yeah,
Yeah, thank you for that question. And I like that you emphasize on in your situation so that I
yeah,
don't make generalized comments.
that's
So
right.
in my case, I had completed masters from the same faculty. So I was well known by my
Okay,
faculty. And that was one add up for me. The other add up was I had throughout my journey in academia, I have developed these political behaviors of, I mean, moving with people that can influence my decision, something like mentorship.
okay,
So there was this professor called Dr. Linda Ogilvy that I have discussed my career plans with her. And she suggested to me that, Emmanuel, if you want to do this research work, if you're moving away from education, then go and talk to this person. She is the expert there. So I book an appointment with this supervisor. Before then, I had sent my proposal, my writings, and all those stuff. And then we met and discussed what we wanted to do. And in about weeks, I got a response from her that she is willing to supervise me. I think the most important thing is getting a supervisor
okay,
for the PhD. The most important thing is getting somebody who is willing to supervise your program. If you're coming from Ghana, the other thing will be um, your ability to prove that you can fund your education.
mm,
That is for immigration purposes.
okay,
And one other thing is that faculty of nursing here is not limited to only master's graduates from nursing. You can do public health, and then if your research program is aligned with a supervisor who is in our faculty doing that similar research, you will just have to take some of the nursing courses that bridge those gaps in disciplinary knowledge, and you can still do a PhD in nursing without necessarily doing masters in nursing, because I have a colleague who did MPH. I have a colleague from kinesiology, and I also have a colleague from how do we call it, dental hygiene, doing
Okay,
PhD in nursing. Yeah,
interesting. Great. Of course, I mean, like as you rightly said, I have seen your CV. You've won a number of grants, and I guess what I wanted to ask, you've explained how the process has been for you, but how did you position yourself to win this grant? Of course, you did mention your academic performance, and also you did said you position yourself by getting politically connected to people in quote. But beyond that, are there any other things you did from your master's to your PhD that positioned you very well to be able to win grants or scholarships for your studies?
yeah. So one thing that some of us may not be aware is community service.
Okay.
If you are in academia, your work is not only limited to reading, writing, publishing, and all those stuff. What are you giving back to your community? So let's just do this analogy. Somebody is an above average student getting like 80% in their courses, and this person does not engage in anything apart from going for seminars and just concentrating on their studies. And another above average person who is serving on committees, faculty committees, going to the society to do volunteer works, attending workshops, and apart from all these things, attempting to disseminate knowledge, whether traditionally or non traditionally. If these two people approach you and apply for funding, who would you give?
Of course, the one who is quite engaging.
Community services, right?
Absolutely.
So it's not only academics, you do the academic parts, and there is also a need for extracurricular activities. And these can occur in the form of joining professional associations, serving as committee members, and like I have worked as a volunteer in a long-term care home without getting any money. I'll just go there to keep them company, right? Yeah. So to keep them company, converse with them, um, walk with them around, and I book those hours. These are
Wow.
all sort of volunteerism, and it's very, very important in this particular context. So as you focus on your academics, you also find time to give back to your society. Yeah,
Oh, that's encouraging, Emmanuel. Thank you for that. I mean, of course, I think we can't underestimate the power of volunteerism. It is very key to our everyday life, and I'm glad you were able to emphasize that. So you are, like you rightly said, you do a bit of volunteerism, but again, you are also, like you did mention in your introduction, you are a licensed practical nurse in the in Canada, sorry,
yeah.
and you're also, of course, a registered nurse in Ghana. Can you take us through the process of registration for nurses in Canada?
Thank you for this important question. It can be a reminder of some unpleasant memories, but I think it's worth talking about it.
Okay.
So I got to Canada in 2018 and I became a licensed practical nurse in 2020. Um, it starts with evaluating your credentials with the National Nursing Assessment in Philadelphia, that is United States. And once you get your credentials assessed, then you would have to contact the nursing board. But there are a lot that goes into the credential assessment, so I'm going to be detailed. They will have to assess the curriculum in your undergraduate nursing program. Then they will also have to assess your registration with the nursing board, so that in our case the nursing and midwifery council, they will have to verify your registration, and then they would also have to verify your identity documents. So that could be a birth cert, That could be a passport, any legal document, um, identity document that is issued by the government. Those documents need to be notarized by a lawyer or a medical doctor or somebody in position. And once you have submitted all these documents and made a payment of like 650 US dollars, that is around $900 equivalent, then your credentials will be assessed. Yeah, one other thing, you have to submit English language proficiency documents. That is, if you are applying to all the other nursing boards, with the exception of College of Nurses of Ontario, that might waive that for you if you've had a Canadian education or worked in Canada for some time. So this process can take up to 1 year before you get um, your reports. And so in my case, I did apply for both the licensed practical nurse and the registered nurse because I knew I was involved in so many things at a time. And the preparation for the licensed practical nurse isn't as rigorous as the registered nurse. And so I wanted to go step by step.
Can
And
you just, before you go ahead, for purpose of clarity, can you distinguish between the two, the registered nurse and the licensed practical nurse again?
it's a matter of scope of practice. So
Okay.
just as in Ghana, we have um, how do we call it? We have degree
Nurse
nurses,
assistant, yeah.
being prepared purposefully to occupy leadership and managerial positions. That was the goal for the creation of the Bachelor Science degree in Ghana, to occupy leadership and managerial position. So that is RPA. The LPN is more skilled practical already. So hands up, the job is being done by the LPN. Yeah. You cannot be there is no way an LPN can rise to become an in charge. Yeah.
Okay.
And that is different from nurse practitioner. The
Okay.
nurse practitioner is legally authorized to initiate assessment, complete assessment, and perform advanced interventions on patients, and as well prescribe up to some level of medications to patients. Yeah,
Okay. Interesting. But of course, like you rightly alluded to, we have lesser diploma and degree nurses. But the basic, of course, the scope of practice will distinguish to what level you can practice. But basically, there are some underlying duties that cut across, isn't it? So you can
of
work
course,
principally. Okay,
of course.
brilliant.
Yeah, there are. Yeah,
Brilliant.
yeah. In fact, when you are learning for your board exams, there are some delegations that this is the role of the LPN, this is the role of the RN. For example, LPN does not initiate blood transfusions, but on some wards, you will see some LPNs not initiating, but per se taking active role in that. So
Okay.
there are those areas where um,
Okay.
roles kind of conflict.
All right. Here in the UK, we have adult nursing or adult nurses, mental health nurses, child nurses, and of course, learning disability. Is it the same for Canada or do you have other classifications?
Yeah, so that is something that I work on in my master's program when I did a curriculum comparison of
Okay.
Ghana versus University of Alberta. Um, Nursing programs in Canada is a generalist one. So
Okay.
the basic nursing program does not lead to specifications. Just like any discipline, like medicine, like
Okay.
law, you don't see a basic medical officer or a new medical officer calling himself a pediatric surgeon.
That's
You
right.
have to have that general knowledge first. Then, based on your practice, you move towards a specialized area. But of course, Ghana's curriculum is modeled after the British style. So we have these specialties there. But for Canada and the US, these specialties exist after you have acquired the basic nursing credential.
Okay. Ivarista Ozegbe, I hope I got the pronunciation right, says, please, I want to know if a UK trained mental health nurse can practice in Canada. So I think it ties in with the question I had asked earlier. This is someone who is trained and, of course, registered as a mental health nurse in the UK. Does that mean that based on your explanation, if I got you right, if this person should register in Canada, he or she will obviously be a general nurse? Is that right?
It depends. So
Okay.
for some jurisdictions, again, Canada is a federal state, and so every province have their own jurisdictions. Like in Alberta, where I live now, we
Mm,
also have a class of nurses
okay.
who call themselves registered psychiatry nurses, and that is
Okay.
one thing that is very particular to this province.
Right.
So I think, please, what is her name?
Evarista.
Evarista will have to dig quite a bit more in order
Okay.
to approach that. But so
Okay.
long as she is a nurse, she will have to go through the evaluation processes. And
Okay.
even if the credentials are not equivalent, it may be expensive, it may be boring. There are opportunities to take on
Okay.
those courses in order to bridge that and then work in Canada.
Okay.
Yeah.
All right.
So
Thank you
it's
very much.
possible.
Okay. Thank you very much, Emmanuel, for the explanation you've given to us.
Meet Mr. X, an unhappy businessman who has been waiting for days for his goods to be delivered. Unlike Mr. X, business is booming for Mr. K because of his efficient partnership with Hembeck 60 Hub, also known as HP 60 Hub. We are an online platform that sources for goods from across the globe. We only pull high quality standard products from anywhere in the world and ship them right to your doorstep. Be it watches, clothes, bags, and many others, do get in touch by contacting us on www.henbeckagency.myshopify.com, or you can call us on +233 546 022 952 or hembektravels@gmail.com. Hembeck 60, truly a world of endless possibilities.
Thank you very much. So, if you want to actually source for the best of bags, books, footwears, any of these items, please contact Henbeck 60 Hub on Facebook Messenger or +233 546 022 952, or send them an email at henbecktravels@gmail.com. If you want to source for footwears, clothes, watches, bags, and books from any part of the world, you want a company to source for the best of these materials or these particular products and ship them to you wherever you are across the world, Henbeck 60 Hub is the best organization or agency to contact. +233 546 022 952. So, Emmanuel, just tell us a bit about the practice in Canada. Of course, you practice in Ghana, and of course, now in Canada. Is there anything of particular interest you want to share with us? How can we improve our practice back home? We are using Ghana as a case study for, of course, other developing countries. What can we do to improve our healthcare system?
I think we need a rigorous curriculum development, curriculum revision, rigorous
Okay.
curriculum revision that reflects leadership. Um, I'm not sure. Maybe you might have experienced this having schooled in Ghana and schooled in the UK. You realize that our educational system is only mostly focused on memorization and reproduction. And so we are slightly behind in terms of creativity,
mm,
initiative, and leadership. And
mm,
the image of nursing is evolving. We are no more behind every doctor, there is a best nurse. We are no more behind every male, there is a woman. Nursing is no more gendered. Nursing is no more a sub-servant profession. We are
mm.
taking leadership roles. We are taking administrative roles. You can see recently a nurse being ushered in as a vice chancellor
Vice Chancellor,
at the university in Ho.
University of
This
Health
is
and Allied
yeah,
Science.
yeah. So this is where nursing is going, and with that bootlicking attitude, with that um, memorization, with that how do we call it, style, where there is no room to muddy the waters, to make mistakes, to create something new, it will be very difficult for us to match up with our colleagues from other side of the world.
Mm,
Working as an LPN here for the past year has meant taking on leadership roles. It has meant supervising about 8 healthcare aides on a shift. It has meant collaborating with paramedics to transfer patients when there is a fall, and rigorous assessment of clients and contacting the physician on call in order to intervene. And all these things are guided by laws. And so if you don't do it well and something happens, you are held responsible.
mm,
Do we have such accountabilities home? Does our curriculum prepare us to even speak up when other professionals are bullying us?
mm,
So for me, speaking from an educational perspective, I think we need to incorporate some critical theory in all aspects of our nursing curricula. We should
mm,
move it from training to education. When I say training, we should move it from repeating the status quo to giving people, assisting people to search for information and use those information to create new solutions and improve the quality of whatever that they are doing at any point in time. Yeah,
spot on, spot on. And I'm glad you've mentioned this. We've basically emphasized this over and over here on this platform with different guests. And I'm glad you've also mentioned that as well. We need to really do more beyond what we are just taught. And of course, there's a need for curriculum review. And I'm glad that we have people like you who have interest in that field and are coming up. So thank you very much, Emmanuel, for that.
you're welcome.
Let's do a bit of your master's and your PhD. We've spoken about the processes, how you go there, and all that. You seem to have a very well defined area of research interest. So, for your master's, you did something for your project, you did something on awareness and preventive practices against human papillomavirus infection and its related cancers across sub Saharan Africa. And of course, that was an integrative review. And for your PhD, you are looking at enablers and barriers to human virus vaccination practices among Ghanaian nurses, a case study to support the implementation of a national HPV vaccination program. So, of course, your special interest looks like it's human papillomavirus infection. Can you educate us a bit in that area? What is this particular, I mean, name about? I'm assuming not everyone watching us have a fair idea of what HPV means. So, what does it mean? Can you educate us a little bit? And of course, take the opportunity to tell us in basic language what your master's was about, what your PhD was about, and the essence of the project. How is it going to impact on practice and to improve the health of the general population? It was your PhD is Ghana, your master's was Sub-Saharan Africa. So of course, we're not talking about nursing alone. It's a big umbrella to cover anyone who is watching us. So please take it away in about 5 to 10 minutes.
Yeah, thank you for this question. And the last comment kind of answers part of my question for me, because PhD you are narrowing down.
That's right.
Actually, when I had come to Canada, I was coming to do something on curriculum development. But curriculum is a political area, and I didn't have those political wings at my master's level to do that. It was and how I got into HPV was based on my own negligence about HPV. I was taking a qualitative research course and was doing a critical appraisal when I realized in one of the papers that I was appraising, there was a report on increased head and throat cancers that is related to human papilloma virus. And I was like, I'm a nurse, completed University of Ghana. I've heard HPV and cervical cancer, but
Yeah.
I'm not sure how it is linked to human papilloma virus. How do we call it? Head and throat cancers.
Cancers.
So, if me as an individual nurse, even pursuing higher learning, I don't know this relationship, given the diversity among sexual practices, given the social locations occupied by different people. Because I've heard of HPV vaccine before in Ghana, though, where one of my rich friends will say, we are going to Rich Hospital to take vaccine, my sister and I. And we were like, oh, they are just going to take vaccines, but we didn't know what they were preventing. But these are privileged people. What about
Mm,
those living in the village?
mm,
What about those kids on the streets? What about the orphan whose parents are not there to take them to the clinic? So I did some reading about it, discuss it with my supervisors, and they were like, okay, if you're going to do PhD on HPV vaccination, it will be important for you to look at the knowledge and awareness in this context. And
mm.
so my master's project shifted from curriculum development to a literature review of HPV knowledge and awareness in sub-Saharan Africa. And the key finding was that the knowledge of HPV and HPV vaccines in sub-Saharan Africa is still low, even though we are still Africa, sub-Saharan Africa is the highly burdened and highly impacted population from HPV. If I'm to provide context, HPV causes head cancers, it causes throat cancers, it causes oral cancers, it causes cervical cancers, and it causes anogenital cancers. That means the cancers of the anus, the vulva, and the vagina. And looking at these sexual behaviors like blowjob, whatever, fellatio, and all those stuff, it is an important topic that we need to address in order to prevent, if not a pandemic, an HPV epidemic. Yeah,
Wow. Interesting. So that is, of course, that is what really led you on for the PhD as
from
well.
yeah,
To now concentrate on nurses, isn't it?
yeah. So I'm
Okay.
now in the PhD program. I wouldn't. Um, I'm still conceptualizing my projects, and
That's right.
how projects can be stolen. I wouldn't
Mm,
want to talk too much about that.
absolutely.
You know the politics of some of these things.
Absolutely.
People will just
Absolutely.
steal your ideas, and before you realize it's out there. But
That's right.
yeah, it's already been published, and your work is no more useful
That's right.
because a
Yeah.
PhD dissertation should add up to the literature. But what I'm seeking to do is to just explore nurses' challenges in giving HPV vaccines to the population. And I'm
Okay.
looking at all those variables that shape those practices. Mhm.
Okay. So where exactly are the gaps when you talk about human papilloma virus vaccination and all that? Let's look at the general population because initially we spoke about sub-Saharan Africa. Where are the gaps in terms of creating awareness? Do you think government are not doing enough? The media are not doing enough? Healthcare professionals are not doing enough? Where exactly is the problem? How can we improve the awareness? Because of course, even on this platform, we had quite a lot of people watching, but as soon as we spoke about research and all that, a lot of them just dropped off because, of course, that is not important or that is research. But how can we bring this down to the level of people so that they get to know that these research and research works are not done just to be on the shelf, but they are supposed to translate into practice and to improve the health of the population? What can we do from your perspective? What do you think?
So the first thing, the gaps occur at several levels. At the
Okay.
individual level, there is low awareness. In fact, HPV is among the most commonest sexually or reproductive infections. HPV, chlamydia, gonorrhea, they lead that. But why isn't it a priority in our context? If you look at the onset from HPV infection to becoming a carcino, how do you call it? To go through the cancer processes. I don't want to use jargons.
So,
Yeah, if you look at that, it can take from 10 to 15 years for an HPV infection to become a cancer, right? Based on repeated exposure of the HPV virus. And so, if somebody is having this and the person is not having observable signs and symptoms, of course, it can cause genital warts, but not all genital warts ends into cancers, right? Even mostly the HPV that will cause warts may not end up in a cancer, right? So, if you're having an infection and you're not knowing any signs and symptoms, would it be something that would be worrying for you? No. So that is one thing. And it's not, looking at Ghana, we are affected by so many chronic, or let me say infectious diseases that have very bad outcomes, and that take priority for government interventions against HPV. For instance, if you look at the mortality or the morbidity and mortality rate among children under 5 with malaria, if you look at the HIV epidemic, if you look at tuberculosis, like the government expenditure going into these infectious diseases and looking at the time HPV takes to become a cancer, then it's kind of, it appears, I don't know the policy yet, but it appears that it's not a main health priority for our Ministry of Health, even though HPV cancers are equally fatal as these diseases that we've just talked about, right? And so we should give it a priority, but then it's not a priority. One other thing is that nurses themselves, or the stakeholders of health who are supposed to deliver these HPV vaccines or interventions, are not aware. They don't even know. Some of them, let me choose my words well, don't even know HPV vaccines are available.
that's right.
Some of them don't know the eligibility criteria, because at first we have only associated HPV vaccines to only girls and women, but now we know head and throat cancers can occur in men, right? And in developed countries like Canada, we are giving HPV vaccines to boys, but this knowledge is not common in our context. The other thing is that in the absence of a national vaccination program, HPV vaccine is very, very expensive. And that is
Okay.
where the class and the social location comes in. The rich versus the poor.
Cool.
Somebody, the rich versus someone living with poverty. I want to be cautious with my words. Somebody struggling to acquire 3 day square meals How can this person raise 100 cedis to pay for a shot of HPV vaccine?
That's right.
So that is another issue. If we prioritize it and include that in our national vaccination program, then it can be accessible and equitable to everyone. As of now, we only have few clinics in Ghana that deliver HPV vaccine. What that means is that if you're living in Kaswa and there is no clinic there and you want to get HPV vaccine for your daughter, you have to travel to Rage. The cost involved, that is
Mm.
another problem. Yeah. So there are so many issues that we can talk about.
Wow. Thank you very much for exposing us to such light um, with respect to HPV vaccination and infections. I think if you are just online, perhaps you might have learned for the first time, if you didn't know already, that it's just beyond the usual, I mean, HPV that is associated with females and cancers and infections. Head and throat cancers can also be associated with HPV. So, of course, we are all at risk, and therefore it's important that we take this very seriously. And if you can afford, of course, go for it. If you're in a country that do not have a national vaccination policy that can try to reduce the cost for us. Lastly, let's talk about something because you spoke about nursing curriculum and also you have also done your masters and are currently in a PhD in the nursing field. You have one publication that is titled Transforming Academic Internationalization in Nursing Education in Ghana. Can you take about 3 minutes to explain to us in basic language what you mean by this? Yeah.
Thank you for this question. In fact, that was my first publication for my master's.
Publication.
Yeah, for my master's program because
Okay.
um, my master's focus on nursing education.
That's right.
When we talk about internationalization and globalization of academia, we are talking of multiculturalism. I mean, moving education beyond national borders and more or less like diversifying the academic context. And so we adopted a reflective stance and looked at how internationalization, international partnerships of the University of Ghana with foreign organizations or even other organizations in Ghana have impacted nursing education and what ways can we improve that. So in that paper, we talk of the history, the first bachelor's program through the World Health Organization and all those stuff, getting a bachelor's program at the University of Ghana in 1980s, and at a point in time needing lecturers or tutors to teach and also lead, how do we call it, the nursing programs, and that's called for collaboration between University of Ghana and University of Alberta to establish an MPhil program at the University of Ghana in 1999 and 2000, and our current state. Of course, now you can't see any nursing school in Ghana that does not have a product from University of Ghana. And if University of Ghana will be able to talk about this, is out of this collaboration because as we prepare the MPhil holders who assume those lecturer roles in the other institutions, we kind of built how do we call it, capacity, right? So that was some of the lessons that we got from that, and it wasn't a one-way affair. University of Alberta also benefited by sending their undergraduate students to Ghana and then learn community health nursing. So it's not like Ghanaians, we don't also have things to offer. We
Yeah.
have some important areas of expertise. But then what is the gap or what are the gaps in these international collaborations in our contemporary times or like in the current state? Some of these partnerships are reflecting skewed benefits, as we've seen in collaborations between high income countries and low income countries. And I'll use accessibility to the clinical setting as a typical example. International students in Canada here without credentials cannot do anything at the clinical sites. Even in the pandemic, where there were health staff shortage, where some of us wanted to support the healthcare system because they didn't have those credentials, they couldn't get in there.
Wow.
But when these international students from advanced countries get into less developed countries, they have access not only to the clinical settings, but to
Yeah,
our patients' homes.
absolutely.
So you see that from an equitable stance, the learning opportunities for the parties involved in this international exchange is not equal because
Absolutely.
they can do research and they can learn, clinicals and all stuff. But when we come here, we are just limited to research. So what can
Mm,
our leaders do when they are forming these collaborations? Of course, they are right that to be able to provide a safe care, you should know the culture of the context. But we can create programs to orientate international students to these cultural expectations in order to provide a safe care. And that is, I mean, the summary of that paper.
wow. That was that's a very good one. It's something I'm particularly interested in. I mean, it's very critical, and of course, exchange programs, memorandum of understandings between universities are, I mean, extremely important. I can't overemphasize that. So I think, I mean, you've thrown a lot of light on this, and I think if there's anyone watching us who is in any capacity to, I mean, try to foster such relationships with external partners, it's a beautiful thing. And thank you very much, Emmanuel. Before we just conclude, it's been a very interesting conversation on so many things, and I want to believe our audience have been able to benefit from that. Um, you just talk about mentorship and all that. If there's anyone who wants to reach you for some sort of guidance, support, I've always said to my guests or to my audience that I know our guests are very busy people, so it is not an opportunity I'm presenting for them to, in quote, adapt to the work. But if there's anybody who want to reach out for some sort of support or advice or clarification or anything, is there any way they could reach you?
Yes. So I have always said mentorship is not only one way affair because
That's right.
we are also learning. I think I'm just in the early stage of the career. So although we have read and learned some things, we still need to learn more. And people should feel free to reach me on via my professional email.
Okay.
Um, marfo@ualberta.ca, and I will respond. I respond very quickly with emails. And
Okay.
yeah,
Marfo at
CA.
ualberta.ca.
CA.
Okay.
Yeah.
CA. Brilliant. Thank you very much. Any final words for us?
Yeah. My final words to the nurses and any other person out there listening to this interview is that they should move up. They have the potential, they have the abilities to get to where they want to get to. It's just about taking the initiative and then implementing those actions. They should move up. They are capable. Thank you.
Beautiful words there from Mr. Emmanuel A. Marfo, who is a registered nurse in Ghana and also Canada, as well as a PhD student in the Faculty of Nursing, University of Alberta, Canada. So, I mean, Emmanuel has a very impressive CV. He's doing extremely well. And of course, you can just hit him up as he has rightly given you his contact. He's doing amazingly well. And I think the purpose of this interview, as you've known if you've been joining us, is to encourage you that wherever you start from, you can definitely reach wherever you want to get to. One of the things I picked from him was that he had the determination to go ahead and complete his master's and PhD. Even though he did not have the scholarship from the onset, he still persevered. And here he is now. Beyond that, he's won grants and other things that have supported him up to this level. So, of course, if you are starting anything that is quite challenging, keep persevering, and of course, you'll be able to reach that height. So, Emmanuel, we just want to say keep pushing, do your very best. We pray that God will give you the strength, the wisdom, the energy, and the capacity to be able to attain the higher heights that you want to reach. And here on the Discovery Show, on my own behalf, Precious Adadidiodu, and also the producer of this show, Mr. James Kobina Opon, we want to say thank you very much for honoring our invites and sharing some very insightful thoughts with us on this particular day. And for our viewers, we want to say thank you for joining us. Thanks for your comments, your questions, and also for spending time and data to join us. Catch us same time, another time, probably in 2 weeks' time, and we'll bring you another exciting time. So thank you very much, Emmanuel.
Thank you, and thanks to all your audience.
Thank you very much, Emmanuel.
Bye.
Life is a journey and sometimes can be a lonely road. When friends and loved ones forsake you, all you got to do is to be bold. I knew it years ago that those who undermined me had their minds undermined, but I never mind. They should keep on undermining because I'm a real good. I must undergo mining. Talking of mining, it leads to discovery. We mine to discover, we learn to discover, we observe to discover. Friends can uncover you at the same time discover you. But I don't want to discover you, I would rather discover more, so I go on the internet and I listen to words of wisdom and intellect. Availability of information, interviews of great men and women all over the diaspora and all nations. Creativity at its best, dexterity of research, no need to go through any formal education. I introduce you to the Discovery Show. Let your friends and your family know the struggles before the blow, their highs and their lows. Pay attention to this show, it will make you feel at ease. The Discovery Show on YouTube got the steez. Now Perry, the presenter, please pose for the camera. I want to hear you say cheese. We are airborne like a flu. I want to hear you sneeze. It's true. The Discovery Show is live on air, Instagram, Facebook, YouTube. See ya. TDS TV, Yearn to Learn. Host, Harry Precious. Executive Producer, James.